Hi, I'm Darci, and I have breast cancer. I am 9 weeks post-op from a bilateral nipple-sparing mastectomy with immediate tissue expander reconstruction, which is a lot to say, but if you are a person who is currently debating whether or not to have this procedure done, if you've just had your biopsy and received your diagnosis, I know how stressful it is. It's a lot of choices. I looked up a lot of things myself, a lot of information, and there wasn't a lot on nipple sparing, which is kind of new. Not really, really new, but new enough that I was unable to find a ton of information on it. And I also went over the muscle, which we can talk about in a future video, what all this stuff means. It's a lot, and you have to decide pretty quickly. You know, during the time, you're dealing with a lot of stress. You're dealing with a lot of tests, and you kind of just want it out of you. But then at the same time, you have a lot of options if you're like me, where I had low-grade invasive ductal carcinoma, and it was in a good location. Good being, I had it in ductal being milk ducts, so it was in the back part of my right breast. And I knew right away that I was going to go public, but this is my very first YouTube video. I went public on my Facebook to my family and my friends and my coworkers, which I work with a lot of guys, so sorry guys. I talk about my boobs all the time, and I like touch them and stuff, and you know, I'm not trying to make anybody uncomfortable. It's just, I'm very open about what I'm going through, and I felt like if I can help somebody get through the scary parts and move to a better space personally, I kind of hope that I can do that for other people, and I hope that I can answer questions. So if you have any questions, feel free to ask. If I don't know the answers, I'll let you know, and I'll try to direct you to somebody who does. But the purpose of my making these videos, I'm going to make more, is hopefully I can provide some advice, you know, just really not advice. I'm not a medical doctor, and I'm not saying anything medically. I'm just telling my own story, my own experience. Everybody's going to have a different experience. Everybody has a different cancer. Everybody has a different surgeon. You know, that's what it's going to be. But hopefully, if you don't understand something, maybe I can clarify it for you. Hopefully. And in the meantime, I'm going to tell my story. And I wanted to do this before I got my transfer, because I am going to expose the expanders. Obviously I can't show full nipples on YouTube, and I'm not sure I'd be comfortable with that anyway. You know, I'm not that open. So, I have a bikini, maybe some stickers, something fun like that, but I will be showing my scars. I will be showing, you can see the backs of them, the hard backs to them, but overall, I think that the procedure went very well. And I feel like I had the best of the worst diagnosis, and hopefully the transfer process goes well, and I'm fine now. My self-esteem is great. I think if you can't do anything about the cancer, it's not going away. You know, you're not just going to wish it away or eat some herbs and have it go away. It's you've got to deal with it. So if this option is available for you, as of right now, I recommend it. I'll talk about it a little bit further. It was pretty scary, but my self-esteem is really good because I had this option, and that's why I recommend it. So, I am going to tell my story a little bit. So, the beginning of my story is that I had very dense breast tissue. So, what that means is the mammogram could not see the cancer. Even though I had a lump, I knew I had a lump, I had it checked a couple of times over the years, over 2 years. I had an ultrasound done on it previously, and everything came up clear. So I wasn't terribly nervous this time when I got the mammogram this time, and I got called back for an ultrasound. But this time the difference was that my hospital had 3D imaging on the mammogram machine, and it was able to see inside a little bit better than it had in the past, and it saw it. So I had to go in for the ultrasound and ultimately a biopsy. They detected 2 tumors, and I had a lymph node that was adjacent to one of the tumors. So I also had that biopsied as well in that first initial thing, and they were able to come back and tell me that I had 2 tumors. One was 2.4 centimeters, and the other one was 0.5 centimeters. I had invasive ductal carcinoma, which means that the cancer cell had scattered. Invasive means it was starting to go into it was out of the cell and beginning to go into the tissue. And having 2 tumors, having the larger one and then having the little 0.5 centimeter one, does not mean that the big one was making little baby ones all over inside. What it actually means is that there were 2 completely separate cancers. So when you have more than one, it literally is that. It's another cancer forming, a different one. So that's pretty scary. But I learned that I was tentatively stage 1, which they will not stage you until after your surgery, until they get everything out. They take a good look at the actual product in there, and they pull the tumor out and pull it apart. Then they'll give you your actual official stage. But they gave me kind of a meh, we think this is where you are. Stage 1, low grade, level 1, low grade cancer. That is very good. Cancer goes on a scale of 1 to 3. 3 is the most aggressive cancer. And mine was low grade, which was good. And of course mine was located back here in it's ductal, so it was in my milk ducts, back in the back part of my right breast towards my armpit. And I also was PR plus with HER2 negative, which means I was hormone receptive. So what all that means when I first learned my diagnosis, that pretty much means that for sure I was going to have surgery and hormone therapy. So I knew that from day one. This is what you are going to do. What I didn't know is, do I need radiation and do I need chemotherapy? Or, one or both, or how much, or what. And so then the tests begin, and there's a lot of tests. I also had a lymph node biopsied at that same time, and that's really scary. I had to wait about 4 days for them to get me the results of the lymph nodes, because they gave me the biopsy results as quick as they could. It was like 48 hours or something, but the lymph node hadn't come back yet. and there was a weekend in between. So I kind of had to wait like 4 days, which was really nerve-wracking because the lymph's job in general is to pull out infection from your body. So typically the first thing that'll happen is that your lymph nodes will fight the cancer, and they'll try to suck it out of you, you know. So the first place that it will go is into the lymph nodes under the arms. And once it's in the lymph nodes, that really does change treatment options. That kind of more solidifies chemotherapy, because the lymph nodes also feed your bloodstream. They go all through you. So once it gets into those lymph nodes, you really don't know where it's gone. You know, maybe it just barely got in the lymph node and you're going to get by okay, or maybe not. Maybe trace amounts of it went into your body. So that's the scary stuff. But eventually it did come back, and it came back negative. So that was step one. That was all kind of good news. And they scheduled my surgery. I had to meet with a cancer surgeon, an oncologist, a geneticist. I actually had to meet with a dermatologist for another issue I had with some moles that ended up actually being cancerous as well. And I also had to meet the plastic surgeon. So I had a lot. I had about 8 doctors or radiologists or everything all together. It's kind of a blur. But after that first initial series of tests, I got to get scheduled for a bunch more. And I had to meet with my cancer doctor. And that's when they discuss your treatment options. And since mine was early detection, and everything I said, low grade, hormone receptive, and the location of it was good, they told me I was a candidate for full nipple sparing. Initially, I freaked out, and I just kind of wanted a lumpectomy. I thought, oh, just cut it out. You know, it's only a few centimeters. What's the big? You know, just take it out. Give me a little radiation and a pill, and I'm on my way. And it's really not as simple as that, and I guess I naively thought it was going to be as simple as that. And I thought that if I did it, the lumpectomy, then I could avoid chemo. Like, I don't know what I was thinking. For some reason, my brain thought, hey, if you do the lumpectomy, you don't have to do chemo. That's not true. I don't know where I got that from. Some of my crazy internet research, I guess. But they talked to me about my options in that way, and I actually found out if I had the lumpectomy, it's actually the opposite of what I thought. You'd have to do chemo to shrink the tumor before they took it out. So chemo would be like almost a definite if I had done that. So that's where I was with that. And I had to get an MRI scheduled to see if there was anything more in there. I had a follow-up ultrasound because they wanted to check the rest of my lymph nodes and my left side. They checked my whole left side, but they wanted to check the lymph nodes under both arms, on both breasts, to see if they could see anything more. And then I had the MRI. The MRI ended up finding another tumor and 2 questionable lymph nodes as well. I think the MRI was the scariest test that I had. I had to wait. Again, there was a weekend involved, and I want to say it was Labor Day weekend, if I'm not mistaken. So it was a long weekend, so I had to wait longer than most people do for the results of that, and that was terrifying. I was so worried that it was going to be in my bones. Breast cancer can cause bone cancer, lung cancer, you name it, it goes there, and that's the really scary part is, did we catch it in time? Is it where it should be? Just stay in the boob, and, you know. So I did get that back, and yeah, I was all good as far as it goes. It was contained to the breast. However, the MRI did detect a third tumor, another small one, And the third tumor they couldn't biopsy because it would have to be an MRI guided biopsy. It was in a really weird spot, very deep in the center of the breast, and they couldn't, At that point, I had made my decision on getting the mastectomy, so they figured they'd just go in there and take it out, when the time came. So the other test I had to get done that really, really scared me was the genetic testing. They had to test me, first off, to see if I was menopausal, because I'm in my mid-40s, and I don't have my parts. I've had a hysterectomy when I was in my very early 40s. So I had to get a test for that, and that determined what hormone they could put me on, whether I was pre or post-menopausal. It depends. And then they put me on that hormone. So I had to wait for that as well. But I also had to get a genetic test, as I'm sure everybody does that has cancer, and that was really scary to me. I have a son and 2 daughters. One of my daughters is type 1 diabetic, and what that means is her immune system is very weak. And with Mom having breast cancer, it was terrifying to me that I would give this to her or to any of my children. That I felt such an amazing sense of guilt that, I don't want them to have to do this. I've got to go through this. That's fine. Don't make my kids go through this. So that was a really scary test, and that takes 2 weeks to come back, and the whole time you're just like biting your nails going, please, and I also made a personal choice to I had them tell me absolutely everything. Don't hold anything back. Tell me everything genetically that I either had passed to me, that I may get in the future, or that I may pass to my kids. And you don't have to do that. That's a choice of your own. You only have to know about the cancer you have right now. But I made a personal choice to find out everything. And I did. So that actually came back very good as well, and I am not a genetic carrier, and I have not had anything genetic. So, which really surprises me, I think 80% of women who have breast cancer have no genetic background and no breast cancer in their family. And 1 in 8 women will end up with breast cancer. Most of them non-genetic. So that's a really crazy statistic. So I'm actually going to wrap this up, and I'm going to make another video later on this week where I talk about my surgery and things that I did to prep for the mastectomy and things that you can expect afterwards that maybe I could have done that I didn't do. But hopefully I can give you some helpful tips and tricks that'll make it a little bit easier for you if you're about to go in for this. And I'm going to put some links in the bottom to some really good websites that have a large community of other breast cancer patients that do a lot of talking, and it's very helpful for answering questions. And there's also a the cancer.org website, which helped me clarify some medical issues and questions I had about my tests and about what does this mean. So hopefully I can be of help. And like I said earlier, if you have any questions, put them in the bottom. I'll do the best to answer them. And I'll see you in the next video.